like whoever is doing counseling, we ask several questions according to certain questions that is in the portal, and then document and write them down. And through NHM, that is 104 Sarathi, it is called. That is a health helpline. And through that, we call up these people individually. So it's a huge, robust task. And initially, we thought we would not be able to do it because we were very few professionals. And then later on, it was very fantastic to see that a lot of people by the word of mouth came in and requested to join in, and they wanted to be trained by us. And now we had actually, completed more than 38,000 individual counseling sessions. So there's a slide if Ravi can show, and I can just tell you people how it is done. And that is the, this is not this slide, the fourth one, the next one. Not this, the next one, that one. The previous one to the second slide, the third slide, yeah, this one. So if you can see this data, there are around, you can see that the psychiatrists and counselors are around 322 or so. And there are more than now 38,000 calls that we had made already. Like if you can see 38,411 calls, and people allotted cases, around 65,000 calls has been allotted to us. And from there, we could complete 38,400 so far. And this is from the statistical data. And you can also see the different kind of problems that people are facing, like depression, anxiety, and other issues which are related to COVID, and which is very much now related to COVID. These are all COVID-19 positive patients. So we have also certain questions related to their financial issues, job loss, and career prospects, and some kind of social stigma. So these are the statistics where we see 4% has depression, and 2% of the population already were having psychiatric illness previously, and that is relapsed now. And a lot of people had physical illnesses. And the financial aspect of it, like around 14%, and 7% and 8%, 15% people need financial help from the government. So, joblessness is very rampant right now because the migrant population also, we found a lot of cases. So this task that we had undertaken is continuing still, and it has to continue for some time more. We had completed more than 3 months here, and people are like learning new things. We have come to know a lot of issues that is impactful for the population who is in need of mental health care, as well as other psychosocial needs. So this is what we are doing. And I think what I understand from here is mental health issues are very complex. Why? Because if I am depressed, so today if I am anxious, I may not know that. People may know that something is wrong with me, and many a times our signs and symptoms are not diagnosed as a mental illness, and it becomes too late. So with COVID-19 patients, what we thought was they might not know what they are suffering from. I mean to say, they might not know that they are depressed, for which they are feeling this way, and they are negative, and they might not know that they are restless because they have anxiety disorder. And they will not call up the helpline numbers, because in the whole of the world, and even in India, in other places, in other states, the helplines are available. In Assam also, a lot of helplines are available to address these issues. But nobody calls up the people to ask, how are you, or what is your mental health, and how are you feeling today, and are you okay? So this kind of questions are not asked. Very few of us would go forward and ask to our own colleagues or our friends that how are you feeling today? So this is something new. And when we try to ask questions, then they come to know, yeah, something has to be, told, and something is wrong with me. Probably I'm not well, and probably I'm not sleeping, and I need to inform that. And sleeping not well and not adequate sleep could be related to mental health issues. So in that way, we try to detect mental illness in this population, and then we give counseling. So what we do is we do individual counseling as well as telemedicine. The psychiatrists are there. So whenever they come to know that these people are in need of antidepressant or anti-anxiolytics, they prescribe telemedicine then and there. And if the counselors find out that these people need, they are suicidal, or some people are like highly suicidal and they are trying to attempt suicide, then we give a red signal. There are green, yellow, and red, if you can see in the chart. The green is for that the person is all right and he doesn't have to again followed up. That orange or yellow is that he may need 1 or 2 follow-up sessions again. We might have to call him up again. And red is the red flag. That is immediate emergency need. That person needs immediate help and somebody else also has to rope in. That is a medical professional or any other emergency help. So in that way, we are kind of catering to each and every person in Assam. So this is what is the initiative, so that everyone is helped and they don't kind of have the hesitation to come forward because we go forward to them. So that is what we are doing at this point of time. Yeah.
Absolutely. So Dr. Hazarika, as you mentioned, people are hesitant. They often just don't call up these helplines. So for people who are in attendance today, could you give us a demonstration or like a brief glimpse into how these conversations go and how your counselors are able to tackle, the issues that are forthcoming?
Yeah, so it is like, we call them up. Our numbers are given. The government gives me the entire, yesterday itself, around more than 20,000 COVID-19 patients list we got with all the numbers and where are they from and their domicile and where are they right now. So after we get everything is given to us, the information. Then the counselors are delegated the responsibility by 104 people. Like we are around 322 people right now. So all of us are given the numbers, say 50, 40, 50 for each one of us. And we are given the dates to call them. Like from these dates to these dates, you need to call these people. So we just call them up and then we say that, are you so-and-so? And I am speaking from Monon. It's a government initiative. And we have heard that you had COVID, or are you having COVID right now? And then the person says, yeah, I had COVID like 7 days back, or I'm out now, I'm quarantined and all that, because we are not, the numbers are so many. When it reaches us, sometimes it is that the COVID-19 people may have already finished their quarantine or their isolation status, and they may have recovered, and now we are calling them up. So we come to know when we call them up. And when they say, yes, I had COVID and now I'm in quarantine, then we ask, okay, this is a government initiative. We would like to know, how are you right now? How are you feeling? And then we try to counsel them if there are any issues. And if they say, yes, we are not being able to sleep and all the time I'm anxious or restless, or if they come forward, then we do our counseling accordingly. If somebody is saying that, the food is not there, I'm lacking food supply, and the government doesn't know about it, and then we try to give him another number so that that appropriate number is contacted by them. Many a times it is interesting to say here that we got a lot of different issues, There was one couple who, both of them had COVID-19. They had no money and they said that highly suicidal. They think it's no point living in this world. And they said that we are contemplating, we'll go to the bridge in Saraighat. There's a Brahmaputra river. On the river, there is a bridge called Saraighat Bridge. A lot of suicides had happened there. But they were saying that we are planning to go there and we want to commit suicide. Then immediately I just had to call up the DGP and tell him, because it was locked down during that period of time. And then the DGP gave me the car, and immediately I had intervened and I went to their house and talked to them and tried to find out what is the real issue. And then we came to know the real issue is that definitely there was no food, no money, and he was supposed to get money from the government, like some salary of 55,000, and that was not given to him from pretty long time. So I had to report to the government, and immediately, that was one wonderful thing that I came across, that money was given to him then and there. And it is one case. So there would be hundreds and thousands of cases where people have no money and no food supply. So in that way, we could at least address certain issues of this kind. There was one pregnant woman and she had no food. We had given food supply. There was one person whose, son had met with an accident and he was in the quarantine center and he did not know how to get hold of that son. And we had, kind of contacted people and get him admitted in the hospital. So it's not about only the mental health issues that we had dealt with. We had dealt with all the psychosocial issues that is related to these COVID-19 patients. So it is a whole gamut of issues. And the cases are very different. There are children issues where the child had COVID-19, the parents could not stay with him, and he was all alone, and the father had to be roped in, and there were no play items. And then we ourselves, we took initiatives to give him play items so that he is kind of engaged in certain things in the quarantine center. So in that way, I mean to say, whole lot of issues we could understand. We never thought, when we started this, we never thought that we are going to deal with these issues also, because we thought probably we are only going to do counseling and, you know, feel good factor, do relaxation, think good, be positive and all those. But when there were real issues, issues about food, issues about shelter, issues about, you know, no money and wanting to die, and this is like big. And at least we could handle certain people if this was happening in and around Assam in the COVID centers. Yeah, so these are the different mental health and psychosocial issues.
Absolutely, absolutely. And as you mentioned that there are multiple challenges that arose around mental health, right? So how can something like this become a regular feature? Because mental health, of course, is a problem despite COVID. So how can this EA be extrapolated in Assam and across the country? How can this become something that's regular, that's provided to people irrespective of the pandemic?
Yeah, it's a very good, question. Fine. First thing is that, yes, mental health issue is always stigmatized. It's like, you know, always seen as something which is alien. It's an alien concept. If I'm having a health issue, that means, I can't talk to people, because if people come to know, then my whole family will be probably discriminated or something like that. So people hesitate and things becomes too big. So mental health issue is like any other physical issue. So people do not understand the concept of mind and body in the interaction. So it is something to do with the biology. It is something to do with the brain, because of which the medicines helps. Medicines are important, as it is important for diabetes and, hypertension and all. And so the stigma has to reduce. I am saying right now about stigma towards not only COVID, I mean to say even for depression. Now depression has become a kind of a fashionable concept. If you say you're depressed, probably people are all right about it. It's acceptable, because the celebrities are having depression. Any Tom, Dick and Harry is having depression and talking about it. So probably this has become a very, very normal terminology. But depression, to call it label as depression, is something which is very clinical. We use this term as a layman concept that I'm depressed, but we have to understand what is depression. So this has to sustain. I mean to say, Monon, this project, what I feel, is a startup for this part of the country. Because prior to this, I'm telling you very, very clearly that clinical psychology or a counselor was not given that much of an importance. Not only in this part of the world, I think this part in the whole of India. It's taking a long time to understand that psychology is not something which is an alien concept. Every day we have to deal with psychological issues, and probably if we have to deal with professionally, it really is a better concept than to deal alone. So I mean to say, this Monon had started with COVID-19, but now we feel we need to sustain it in the rural population, in the interior places of Assam, so that it sustains and people understand the need of psychological care and the mental health care, which is across, diseases like alcoholism, drugs issues, which is rampant here in the Northeast. Depression, anxiety is another issue. It's the issues of faith healers. Faith healers, because people go to the faith healers and they are very much comfortable to go to all these kind of treatments rather than coming to a medical professionals for help. So the awareness, the sensitization by Monon is happening right now. People are accepting the fact that psychologists are also important people, and this profession is really important besides other medical professions. So I think this is the first time in Assam I've got such a support from the public as well as from the other professionals. And Monon in that way has become a talk of the talk of the city, also in Guwahati as well as in other places. And people like from police there, they call me. The other day, what happened, I'll tell you. There was one incident where one lady, one girl, she's around 19, 20 years old. She went to the terrace, and she, like that, that movie Sholay. She went to the terrace and she says, "I'm going to now jump." Okay, and she wanted to commit suicide. And she was on the terrace. When she was on the terrace, the police, the traffic police, the SP calls me. Okay, and he says that, "Ma'am, you're from Monon, right? You're one of the leaders." I said, "Yes." Then he said that this person, this lady is on the terrace. She is now threatening that she will die. She'll jump off. What do I do? I was like amazed. I said that nobody had ever kind of contacted me till today, or so many incidents have happened probably in this whole, world and life in Assam. So I said, what else will you do? You just do the safety measures. You get the net, you do whatever, safety that the police has to undertake. Then he says, that's okay. But if before doing that, if she jumps, then immediately I again had to rush to that scene, and the policemen were there. I had to go up to the terrace, and then God knows how we brought that girl back. And it was an issue of relationship where her her partner or something went wrong, and then we had to stabilize her, and then we came to know that she is having depression. So for these issues also now is Monon is called. So in that way, I think it has a name at this point of time, not only for COVID-19, and people are giving importance to real issues at hand, and it has to sustain. Right. And for sustenance, we are thinking of rehabilitation. We are thinking about, we are doing a lot of programs now. We are doing art and painting competition, mime, jingle, songs, and all those. And we are having a debate competition now. And the debate competition is all about, anyone and anywhere can have a mental illness. That is an essay people are asked to write. And we are having a debate competition on World Mental Health Day. That is on the 10th of October. 10th of October is World Mental Health Day. And Monon is organizing a debate competition. Okay, so in that way.
Wonderful.
Yeah.
Right. So as you said, you've sort of become the person to contact for a lot of people when it comes to mental health issues. But I also want to ask you that while you said that mental health is a problem everywhere and it's stigmatized everywhere, is it important to talk about the fact that Northeast has been historically underfunded and overlooked when it comes to healthcare, when it comes to government funding, etc.? And then do we need to place this as an important factor when we talk about the mental health challenges that people within the region face? So it could be alcoholism, it could be drugs, it could be employment. What do you think needs to be the mentality shift in this matter?
Yeah, mental health issues, as you said, historically, when we understand about mental health, people used to think that this is something insanity. It started with insane mind, right? So people were like kept bonded in the jails and the kind of asylums they used to be kept. So that concept persisted for a pretty long time. Okay, it's an intergenerational hypothesis. It just doesn't go away. Whenever we talk about, madness, we say it's mad and pagal, and, anything that is derogatory is termed with mental illness. And many a times people have a wrong idea that, a person who is mentally ill will never get cured, or it is due to the curse, or it is something to do with sins or past life, so many issues which are all derogatory and which doesn't have any scientific evidence. And that has passed through generations. So remnants of that still remains in our heart and mind. So in order to learn to unlearn those kind of theories, we really have to know a lot. So the knowledge is lacking among people. Even the educated ones, they also feel that if we start medication, we will get addicted to medication. That is a concept. If we go to a mental health professional, then people will not think about, getting married to our daughters and sons, because it's hereditary. It's something runs in families. So if a person has a mental illness, then probably it's something, the risk factor in the family is so high that the other person also will have a mental illness. So all these, knowledge that is poor, that is lacking in concept, needs to be unlearned. Because people have to know that any other illness, how we have when we have a diabetes, then the vulnerability of having a diabetic in the next generation is definitely high, but it is not a one-to-one correlationship. That if my father had a mental illness, I will also have a mental illness, nothing like that. But definitely we carry some genes, the vulnerability becomes higher, but the environment also matters a lot. So coming to alcoholism, as you had said about drugs and alcoholism in Assam or in Northeast India. So as you know, the geographical location of Northeast per se, we know how it is. Like, it is surrounded by all these other countries like Myanmar and Laos and Thailand, that is known as the Golden Triangle, and all other, Bhutan, Bangladesh, China. So the insurgency and other drugs issues are rampant. So it's the closest to these countries. So the different kind of drugs comes easily. It's because the porous kind of boundaries, and so because of that, border issues are there. And so the drugs issues is rampant in Northeast, and it is very pure kind of. It's not mixed. It's just produced there. Methamphetamine is produced, opium is produced, and it just comes in through the boundaries. So I mean to say, so drugs is one thing. In tribal population, tribes are very many in the Northeast. That the tribals are, if you say about Nagaland or Mizoram, Manipur, all these are tribals. A lot of tribes are there. So sometimes the local drink, the local festivals, or the in the religion, in the culture, in the tribe, alcoholism is something which is common. Taking some local drink. So in that way also, it's a part of the culture. So in that way, people get addicted easily. Children are exposed to drugs and alcoholism at a very early age. And when in a critical period of around 13, 14, 15, if the children are exposed to these kind of substances, then the addiction becomes a huge issue. Then the tendency to become addictive is high in this population. So, and because of the easy accessibility, and also because of so many government policies, the revenue generation, the wine shops, and so many other stuff is also there, which contributes to it. And also the people are, I have done studies in alcoholism because my PhD was on alcoholism, my postdoc was on alcoholism. I'm doing cognition in alcoholism. In US also I did in alcoholism. So what we find is, the concept of alcoholism is a biopsychosocial concept. It is something to do with the genetic factors, genes, as well as the environment, as well as the personality of the people. And many a times alcoholics, or we don't call them alcoholics, the people who take alcohol are, the prevention is missing here. How to prevent it? We do treatment when it is out of hand. People come to us when things are already happened. Biologically, it has impacted them. They have liver disease, or they have some kind of seizures, alcoholic, or they do not take care of themselves, personal hygiene. And the kind of problems they come to us is when it is chronic. They don't come to us when in the initial stage that they're having an issue with. And probably if early identification is done by the parents, if early identification is done by the teachers, if the children are absent, or children are behaving in a very different manner, the behavior issues are there, if that could be tapped earlier, probably prevention can happen. And also familial features, because in the family, if parents are taking alcohol and other substances, then it becomes very easy for the children also to imbibe those. And my study was also on fathers of alcoholic, alcohol-dependent fathers, and the sons of those fathers, with sons of non-dependent alcoholic fathers. So I saw that, personality is an issue. If extroversion has more people who takes alcohol, if the personality is immediate gratification is required, if the tolerance is, the frustration tolerance in people is less, then they take alcohol. If the family is dysfunctional, then they take alcohol. So it's a biopsychosocial influence. So we can't say that alcohol dependent syndrome is only for this factor. It is a multidimensional factor for which the role of a psychiatrist, A psychologist and a social worker is very important because it's a biopsychosocial paradigm. So many of the mental illnesses require a psychologist, a social worker, and a psychiatrist. Why? Because these three professionals together can treat one person having a mental or a behavioral issues. A social worker has to deal with the community issues. When you talk about alcoholism, the community issues that, the provisions of tobaccos and the people should not sell tobacco products in certain areas. So there are a lot of rules and regulations of tobacco. So there are a lot of rules and regulations for alcohol, products also. So I mean to say that is in the community level. So a lot of issues. It's very complex. It's very
Right,
complex. Yeah.
So like you mentioned, you sort of pointed to three very essential people in the whole healthcare system: a social worker, a psychologist, and a psychiatrist. So
Yes.
how would you imagine a holistic healthcare system would look like? Of course, it would have people who practice these professions, but it would also be something that's funded and supported by the government and by communities. How do you imagine a holistic healthcare system?
Yeah, so now what I see is in the national education plan, I'm going back to what the basics should be. In the National Education Plan of India, now I'm also taken as the core committee of Assam State National Education Plan. So yesterday we had a meeting, today we are having a meeting right now also. So the psychology domain will be included from 5 years age. Okay, so we are going to include the identification of behavior issues, the psychiatric illnesses, the family, the parental influence in a child from the very beginning. So there has to be some syllabus, regarding psychiatry and psychology, because it's very much related. Education and health goes together. If we talk about, if you don't know, if you don't have the knowledge about all these issues, we will not go forward to take help from anybody, right? So people who know about that there's an eating disorder, if the child is having a problem in eating and, having some kind of anorexia nervosa, bulimia nervosa or something like that, which we call big terms, where a child is not eating well, or the child is eating but vomiting, so these are certain illnesses. But if we think that he's just having an eating problem, he doesn't like to eat, so he's not eating, and we don't have the knowledge that this is an illness. So it has to be started from day one so that people are aware about what is a behavior problem which needs treatment and what is a normal behavior in this particular child. So it's interestingly, many parents comes to me with very simple issues, Sometimes I have seen some mothers coming to me and saying that, my 2-year-old, he doesn't know how to use a spoon. He just spills it all over around when he eats. Is it an eating disorder? When I mean to say, it's a 2-year-old having with a spoon. She's lucky that he is at least eating with a spoon. Spilling it's not a big issue. So then I come to know that probably the mother has a perfectionist nature, and mother is very obsessive, and mother wants everything to be prim and proper. So she needs treatment and not the child. So sometimes it is like, we treat the whole family when they come with children problem, and we see problems with the parents in their parenting rather with the children. So we have to know what is a normal behavior and what is not a normal behavior to understand what is mental deviant behavior, deviant, dysfunctional, and a disorder. So all these are different terminologies which we need to know. Something which is, difficult to understand at that age, something which is harming that individual has to be treated, and it is hampering one's personal growth, as well as having issues with the society in and around him or to the family, that needs treatment in a very simple term. Something which is personally hampering you, you're not being able to focus on doing something qualitative and productive, and something which is disturbing other people also, your classroom or your family, I think that needs treatment in a very, very simple and logical way to think of.
Absolutely. And so here you sort of point to the fact that we have an individual responsibility towards the way we both address mental health challenges and seek help. So what would be some tips that you have for people in general? How can they better understand what they are going through or what their communities are going through, and then approach the professionals like you for help?
Yeah, you mean to say the tips to understand oneself, like that? Yeah. So
Yes.
yeah, the strategies. I everyone is, I think nowadays people read and know because exposure to media and internet is so high, right? But again, overexposure also is creating a lot of issues. So many a times, people know a lot, but the knowledge is also wrong, or something which is more than what is required. Sometimes we talk that, okay, you are having a mixed anxiety and depression, and we say you have a personality disorder. So many terminologies we will say. Then probably that person goes back and reads and overreads and comes back and, no, doctor, I have this, and no, doctor, I think you're wrong in that. People, the knowledge also is immense everywhere. So what I would suggest is that we have to first know ourselves. In order to know ourselves, we have to understand that our physical body is very important. Physical body is having no illness, but no illness doesn't mean that we are healthy, as the WHO definition says. No, it's not about absence of any diseases or infirmity. To be healthy, you have to be socially connected. You have to be emotionally resilient. Your emotional health, the psychological health, and your social health is very important. And nowadays people talk about spiritual health, to have a connection to something which is beyond us, is something which we need to have a belief upon. So in order to have an emotional health, we need to build up our emotional resilience. To understand an emotional resilience, we need to know what is emotion. We need to know, when we are happy, when we are sad, when we are angry, when we are disgusted, when we have illnesses of depression and anxiety, something which is for more than 2 weeks. If we are having a negative feeling or something which is tormenting us, say for example, we are not feeling well and we are feeling sad all the time for 2 weeks, say, if I can tell in a very lay terminology, it's like only 2 weeks. If you are persistently and consistently feeling the same, then you need help. Okay. If your mood is fluctuating, you are, from morning till night, if your mood is not stable and for no reason it is fluctuating, suddenly you get angry, suddenly you get depressed, then probably you need help. So you need to understand, you have to say from 7 days to 2 weeks, am I having an issue for continuously for 7 days to 2 weeks? Then probably it's an alarm for us that we need to go and see somebody or share our problems. We have to be social enough to talk it out. To come to a mental health professional needs a lot of guts and strength. People feel that a person who is weak comes to a mental health professional, which is other way around. A person who is strong will come forward and talk to people like us, who are strangers, but they are sharing their most intimate issues with us. That requires a lot of mental strength. So a lot of people think otherwise. So I would suggest that people need to have the social connection. In this COVID-19, that now that you have given me this platform, we are connected socially, right? So I came to know about you, Health Humain, and how wonderful work that you're doing. You probably have come to know about Monon, and this is an exchange of information that is happening. In that way, we need to be socially much more connected than before because of the physical distancing to be less among people at this point of time. But post-COVID also, I think this will persist for a long time, because socially people are becoming very, very fearful to meet each other. Even if people wants to come to meet me, or I want to go and meet somebody, I have to think twice, because whether that person will really like me coming to his place, which was never there before. So we are getting a little bit more cautious about social connections in a physical manner, but definitely social health is important. That has to be given importance in order to keep a mental well-being. So that is what I would suggest.
Absolutely. I think you've spoken really profound words, and you've spoken about the need for emotional health and spiritual health. And you have sort of hinted at what I was going to ask you next, that this is all compromised during COVID. Our social ties are weakened. We don't feel comfortable going out and talking or even meeting people, right? So how can people deal with this? And of course, even when people are connecting online, there is anxiety that steps in. We're constantly on our screens, we're constantly work from home never ends. So as a psychologist, what would you suggest? How can people continue to maintain those social ties given keeping in mind that we're in a pandemic situation?
Yeah, so you have to be engaged in something meaningful in life. Having a meaning and purpose in life is very important. COVID had taught us that, prior to COVID, a lot of us were doing, things which were not always so meaningful, probably wasting a lot of our time, which we now feel was not required, right? Because we are still living without those activities. So many a times we have to redesign and rethink our life's perspective. And this is the time I believe people need to again redesign their lives and perspectives and the perception about how to live one's life. So personally speaking, when COVID had started and there was a lockdown, I was like completely lost because my patients are always face to face and interpersonal. That is important for us because we always give importance to bodily cues and nonverbal communication, how the person comes and sits and how he's fidgety and moving their hands, and those are also some kind of behavioral observation, which is not possible online. So I was a little bit, taken aback. How am I going to do all these therapies and psychotherapies and counseling and all? But what I have understood is that it is possible. Connection can happen online too, and we definitely can carry on in this profession also. So for the other people also, certain professions, yes, it has become very difficult to continue because the market is bad. The scene is really deplorable. The business is sinking like anything. People, restaurants and other businesses, entertainments are really, really, they have to redefine, but still they can find a new way out, or learn certain new things in life, learn certain new hobbies and make it a passion and a profession. So I think we need to find a new purpose in living. And a change is always a constant thing in life. Probably COVID had changed our perspectives, and we need to again learn to unlearn, as I already said, and learn new things. And living for others is something which we all have to imbibe. In any profession, not to become very self-centered and self-centric, to do something to contribute to the society in whatever ways. Here I can give you an example that during the lockdown, there was this special school. I just called her up and asked her, like, what is the scene? Like, are you getting food? Are you taking care of your inmates well? Because there are 110 people and they're all retarded, all special children, handicapped and all. And suddenly I thought that let me just ask her how she's feeling. Then this lady says that, no, ma'am, it is bad and we're not getting basics, and the main thing that we are not getting is sanitary napkins, because adults also, they like they don't have toilet training and all, and sanitary napkins were lacking in that particular home. I was like, just called up just for no reason, and I came to know about this. I had to do something about it, and I gathered that and started thinking about giving them vegetables and all. So I went to the vendor, one particular vendor, which was like on Saturday or something, very intermittent lockdown, where in between there was like open for some time. So I went and I told the vendor, please give me all that you have, the vegetables, because I have to give it to a home, a special home. Then the vendor tells me, okay, so you are giving it personally. I said, yeah, I'm just going and giving because I came to know about them. They're having difficulty. Then this vegetable vendor tells me, okay, then this particular vegetable, ma'am, you don't have to pay. Okay, you don't have to pay because I want to contribute something onto this. Then I thought it's like contribution can come from anyone in any ways. It is not only the knowledge-based, contribution. It could be in kind. It could be in any domain. We need to live for others. We need to learn to do something for others also, together with ourselves. That is important. That we need to learn from this COVID-19 pandemic.
Absolutely. And what you said is the pipe dream, right? That the community, the people around us look after each other and we continue to become more mentally resilient. So we already have some questions coming in from our attendees, and I would encourage anybody who has questions to please type them in the chat box, and we will, in the question answer box, I'm sorry, and we will ask Dr. Mythili those questions. So Dr. Mythili, I'll just read out the first question that we have. So Mala asks, is the clinical treatment of mental disturbances like anxiety, fear, isolation that have developed due to unwanted situation in the family include medication, or is it just counseling done by a psychologist?
Yeah, that is what I said. We have to screen well, okay? Even if it's a family related issue, definitely a clinical psychologist is the first person who deals with therapy. But if it is hampering one's sleep and biological, features also, and many times we feel that family issues are to be dealt only with counseling, right? Because this is something to do with interpersonal issues. But it has impacted our brain. It is creating some kind of restlessness, some kind of difficulties in our day-to-day life. Maybe that requires anti-anxiolytics also in combination with psychotherapy. So that has to be really known first. Sometimes it's a combination treatment, and at times it is only psychotherapy, that helps. But never to not show, because if you are having an issue, it's better to always go and speak to a mental health professional. Okay, but
Right.
not to think that because it's a family issue, so medicines will not work. There's nothing like that, because a lot of people has family issues. A lot of people are having disharmony. Everyone is not having symptoms, right? But one person is having a symptom. So there is a biological, involvement there. So how to deal with that? Sometimes psychotherapy also has an influence on the biology, because CBT is one therapy, cognitive behavior therapy, that has an influence on the structural and the functional domain of the brain also. There's a lot of research on CBT. So it's a
Mhm.
combination, sometimes it's a combination therapy with psychotherapy as well as pharmacotherapy. But it has to
Right.
be seen first.
Sure, I know you spoke about the medication aspect before, and this keeps coming up even when we speak about mental health. There's a very potent fear of medication. There's a fear that people will get addicted, that they won't help. Could you address that for a second and talk about how do you assuage some of these fears when patients come to you with this concern?
Yeah, we do psychoeducation. Okay, a lot of times people just give up medication and then there's a relapse, or they come with, the psychiatrists, they send patients to us saying that the compliance is poor, compliance to medication is poor, so he needs psychotherapy. Okay, then we definitely have to make the person understand the neurotransmitters, how it works in the brain, and what are the chemical discharges or transmission process that happens in the brain, the biological model, and how these kind of discharges leads to depression or anxiety and other kind of illnesses. Okay, so once the medication is given, how the neurotransmitters works, and it is something which is very much related to the brain. So then we also say that these are certain physical uh, issues that people comment a lot about, giddiness and vomiting and pain in the stomach and headache and all, and they say these are physical symptoms. So how can you say this is psychological? These are physical symptoms which needs physical medicines. Okay, and it should not be treated by a psychiatrist or a psychologist. Then we say these are psychosomatic symptoms which doesn't have any organic basis. It is a physical illness, but due to psychological cause, due to stress or due to different kind of cortisol issues or stress hormonal issues. So you need medicines which is psychiatric in nature, and also you need some kind of counseling. So we try to explain the biological paradigm as well as the psychological paradigm very scientifically. Then the person tries to understand, and asthma and so many other issues, irritable bowel syndrome, these are all physical illnesses, but it is because of the psychological factors. And we definitely explain in different kind of ways. There are process of making the person understand, and that is what is called psychotherapy. Okay, it is not.
Absolutely.
Yeah.
And do you think so? In your years of practice, we know that there is more awareness about mental health now, but do you see people's attitude changing? Are people more receptive to this explanation, the scientific understanding of why they're going through what they're going through?
Yeah, I have seen the major radical changes in this last time, into say 20 years. The first time I was the only first clinical psychologist who was trained in NIMHANS when I came in 2000, then 2002 to 2004. It's a huge change in the people's attitude towards taking mental health treatment. Now people come to us directly and they say that we don't need medicines, we need only psychotherapy. To that level, people are aware of therapies that works. And many a times they feel that, and they know a lot about the side effects of the medicines. So they will say, oh, we will not take olanzapine, we will not take risperidone because, risperidone gives us the side effects and all, which is very much westernized, because I had been exposed to different kind of Western, medicines, and as well as psychotherapy when I was abroad, where I saw people of that category, people telling the health professionals that I don't need this medicine, I need this, directing the health professionals, which was like not in India as well as in Assam. It is more of a guru-chela relationship in Assam and India, right? We just tell them and they have to take. But it's changing. It is changing more in the elite class, and they also are people who are reading books and reading a lot of things. They direct the physicians nowadays, or would like to know about the illness. Before, what I used to see is that they used to just take the medicines and would not even ask the physician or the mental health professional what diagnosis is being made for me. The medicine is given and they just take it, But nowadays people ask, what is my diagnosis? How long should I take the medicines? Is it for life, or is it for a month, or, so that kind of awareness is happening definitely. And there's a plus and a minus point in both the sides, because as I said, too much of knowledge is also making people, inhibit taking medicines in some ways, thinking about the side effects. But the side effects are not a major factor. The illness makes the person so unproductive that the side effects is far less important, than the illness per se. So people need to know that. Every medicine has its own side effect. We can't deny that. Even any kind of vitamins or, anything that we take in life, which is artificial or which is something, to do with preservatives or compositions of different chemicals. But the side effects are far more lesser in intensity, or not very much to think about, because the side effects are very temporary. That doesn't have a very permanent mark on your psyche or in your body. People need to understand that. A lot of children, the parents comes to me and say that, a child is having attention deficit hyperactivity disorder. That is inattention and hyperactive. That the child is restless all the time, cannot sit at a particular place for a long time. And that child needs ADHD medicine. That child will need methylphenidate or atomoxetine and those medicines, because medicine is the first line of treatment for the child. But a lot of psychologists, they say, no, you don't need medicines, therapy will lead to, or our parents will come and tell us that, medicines for a child cannot be given. And that is a wrong notion. So I mean to say, what is required has to be given, and what is required has to be taken, and which is appropriate in adequate dose by a trained professional. Should not go to any quacks and untrained professional. That is very important to understand. Yeah.
Sure. And you've been dispelling some myths that are quite prevalent among people when it comes to approaching professionals for mental health. We have a question from Jyoti, and she asks if people in the Northeast are equally aware about the preventive measures, healthy coping mechanisms, mindfulness, like people in the rest of the country.
Yes.
Maybe you could tailor this to only Assam, because Northeast,
Because if I talk about the Northeast, the clinical psychologists are very less. In Arunachal Pradesh, there is only one probably. In Mizoram, there will probably 2-3 people. In that way, this trained psychologists are very less in the Northeast. Okay. In Assam, also a handful of people are trained clinical psychologists. But we definitely know about all these different kind of therapies, of mindfulness-based psychotherapies, because mindfulness is something which is very much related to, our CBT phenomenon. So dialectical behavior therapy people use for borderline personality disorder, and mindfulness, Buddhist concept, and we are actually using mindfulness for our patients of COVID-19, to be here and now phenomenon, so that people are not in the past or not thinking about the future too much, because we ourselves are probably doing mindfulness at this point of time. If we think a lot about our past, we are going to really be nostalgic. And if we think about the future, we really don't know. It's so unpredictable. So yeah, we know about it. A lot of people who are trained, they know about it. And there are a lot of learning that is going on. And the webinar sessions and this digital platform is making people fully aware of a lot of strategies of mental health issues. Yes.
Absolutely. We have a related question from an anonymous attendee who says that they are a graduate student in psychology at Calcutta University because the courses are not being provided in colleges in Assam. So the person asks, don't you think our colleges should introduce the subject because we want to stay here and work here?
I mean to say nowadays the courses are there in the 11th and 12th standard also. Psychology is a part of subjects, and humanities, and in the graduate level also psychology is in now. Yes, I think 10 years back it was not there, but most of the colleges now have psychology. And masters also, you have institutes which caters to psychology. Guwahati University has, a lot of universities now, Royal Global University has applied psychology, Don Bosco University. I think it has started from 11th standard onwards. And yeah, during my time, it was not there. But now people can come in. We have internship programs. So now I'm starting an internship program online, for the interns from our Society of Mental Health and Islamic Countries. I have a society, I'm the president there. So we are starting an internship program, which is open with curriculum based for 3 months for the interns who have done their masters. So we are starting from now in the 10th of October. Months and give them a certificate like any other internship program which we used to have in the medical colleges. In the medical colleges, people come to me, under me, they do the internship program for 2 to 3 months, who are masters in psychology, and that is mandatory in the medical colleges. But now, because people cannot come and visit us in the medical college, we have started this internship program online. We are having a case studies and case study method. We have tied with Eco India. Eco India is a platform. I have done an MOU with them, and we are starting this internship program, Good Time. And we are going to talk about different patients and different illnesses, different therapy intervention process and all also. So that people from rural areas, from anywhere, they can do the internship program. Because many a times, because of the inaccessibility, and as you know, Northeast, because of the geographical location, the terrain is such, it's hilly and plain and accessible, the communication is not so good. So many a times people do not want to travel and stay here for 2-3 months, and it becomes very difficult for them to learn things. So it's better to do online internship program. We are starting that also.
Absolutely. We have another question which is quite relevant today. The person asked, how do I balance washing my hands enough and not becoming obsessive about it? There is this certain tendency of obsessive behavior that COVID has induced. So how do you think people can manage that?
Yeah, obsessive compulsive disorder is a disorder where you know that you are doing something which is irrational, but still you cannot stop it because you have to do it in order to gain that pleasure, right? That there's a thin line between going and just washing your hands and not being obsessive. If you think that you have washed your hands once and you know that you just done it once right now, then it's clean. But if you think that no, it's not clean, again I have to go and clean it, again I have to go and wash it, and you know it's irrational, but then don't do it. And when you're not doing it and you're not distressed about it, then you're not obsessive. Okay, so you have to test yourself. If you think that, okay, I will wash once and I'm not going to think about it, even if it comes to my mind, I'll not get distressed, then you're not obsessive. And compulsion is the going and washing your hands is compulsion, right? So you just stop that compulsive habit and see whether you're ego dystonic or not, distressing or not for you. If you think it's distressing and you have to go again and again, then probably it's OCD and you will need help. Okay, then maybe you will need medicines, anti-obsessive drugs, or you might start with exposure response prevention like ERP and other cognitive behavior therapy. Okay, but you have to judge and test yourself. Just wash once and just try to forget about it. If it comes again and again, but still you don't go and wash your hands, then it's also okay. It's okay to repeat. Okay, but if you cannot stay without washing your hands and you have to go and do it, knowingly that it is silly and meaningless and irrational, then it is obsessive compulsive disorder and you need help. And medicines definitely is a cure for obsessive compulsive disorder, together with psychotherapy.
Sure, absolutely. So we're out of time, but we have two more questions that are left to be answered. One question is about the attitude shift when it comes to mental health, and Dr. Mythili has already addressed it. So I'm going to take the question by Komal, which is what was your most challenging case in the past, and how did you accomplish a suitable outcome? I would like to tailor this if you could speak specifically about Monon and about the initiative that's going on. If you could talk about that, and it's also an interesting note to end this session on. So yes, if you could take that question.
Yeah, the challenge in Monon is about, the stigma part, okay? The stigma and the discrimination that people are facing in the society at this point of time due to COVID, and how to mitigate that. And we are not being able to do that quite well till today because campaigns have not started. We will do something about it. A lot of times when we face that the people are not, they are given death threat. People having COVID are called and said that if you enter into a village, you will be killed. So we are not being able to do anything in the community level. So that is, I think, is the greatest challenge at this point of time about stigma towards COVID-19. Right. And
Sure.
we are going to do something about it in the near future.
Is there an action plan? Are all steps already being taken? Is that something you would like to tell us about?
We have already started campaigning. We have started an opinion poll from the general public. We want their opinions first from anybody and everybody about how to mitigate stigma. And we have started some campaigns of comic strips and slogans about, stigma, how to eradicate, and writing certain, booklets. We are going to talk about, in the comic strips, we are going to talk about stigma related issues, and we are going to publish that book also. And we had actually engaged some influential people in Assam to write about how to mitigate and reduce stigma. And once we get their write-ups, we're going to go to the government in the policy level changes, ask the government to help us out to have this campaign. And I personally feel what I also thought of doing is that the person who writes very well about how to reduce and mitigate stigma, we are going to call them and make them the leaders to do the campaigns in the community level, So we are still waiting, and we got a lot of feedback. We are getting slogans, we are getting write-ups about stigma from people, yes. And that is going to continue for some time.
Sure, absolutely. Great, awesome. Thank you so much, Dr. Mythili. We're out of time, and it's been an absolutely informative session. Thank you so much for answering questions patiently. You've dispelled many myths that people have when it comes to mental health, whether it comes to approaching professionals, to medication, to just what they can do to be individually responsible. So thanks a lot for joining us today. Everybody who attended, thank you so much for staying with us. You will see replays of this session on social media. Please share it with your friends, and please continue to engage with Monon Initiative. Is there a social media page we could follow, Dr. Mythili? How can we keep it? How can we stay informed?
Health Mission, in National Health Mission Assam website, there is Monon. There is a particular domain. So in only National Health Mission website, it is there. Yeah, not in social media. In all our personal media accounts, we upload. Otherwise, it is a National Health Mission's initiative. Yeah.
Sure.
Thank
Great.
you so much.
Thanks a lot.
I mean to say, I could share whatever we are doing from this part of the country. As you know, it's very, very difficult because of the language issues, multilingual, diverse culture, the diversity is very high, ethnic, tribal population, non-tribal, it's a mixed. The dialects, I mean to say language, communication, psychologists, we only communicate, right? So what happens in Assam only, there are lots of dialects, 2 Assamese dialects, and Nagaland, each village has a different language. In Arunachal, there are 50 languages. So for mental health professionals, it is a very difficult scenario because if you don't know the language, how are we going to talk about it? How are we going to, deal with issues? So even if we are, too many in Assam, but still it's not, it's less because of the untrained professionals more and trained professionals less. But in Nagaland, Mizoram, Manipur, Arunachal, and all these places, I mean to say it's very, very difficult. It's very difficult because need is very high, professionals are very less. So I feel this digital platform, if it helps, in online counseling and online therapy, it is definitely going to be helpful for the people in need and for the awareness program. Probably Health for Mind can do some work with, those interior, Arunachal, Nagaland, Mizoram, and all those places in different ways, some kind of public awareness programs and all, so that people
Mhm.
know about mental health issues. That is one thing that is.
Super. We have the Health of Mind founder in attendance, and I'm sure he's taken note. So thank you so much, Dr. Mythili, once again. Thank you, Health of Mind, for organizing this. Please continue to engage with us on social media, and we'll see you again. Thank you.
Thank you so much.